Hello everyone, welcome back to another episode of the Breast Cancer Physio. I'm your host Jen McKenzie, lymphedema physiotherapist and ESSA accredited exercise physiologist. In this episode I wanted to cover the topic of why some cording doesn't resolve. This is a topic that has been coming up quite recently in the clinic, where patients are coming in with chronic versions of cording and are really struggling to get them to resolve. And I think I've come up with a few theories as to why this might be occurring. So without further ado, if you enjoy this video and you would like to see more, then please subscribe to my channel, which is completely free. Give the video a big thumbs up, hit the like button. If you have any questions, leave a comment in the section below. So let's get into this video. Why is my cording not resolving? So what I've seen from a clinical perspective of late is that a lot of women who've had a mastectomy who also get cording potentially end up with a situation where they are struggling to get the cording to resolve. Now the reason I believe this is the case as to why the cording is not resolving is because, as you can imagine, if you've had a mastectomy, say on your left, and you've got quite a tight mastectomy scar, and then you get cording as well, where that cording often comes in is through this region. And so what often happens is the mastectomy scar and the cord meet up at this point. If the mastectomy scar is quite tight and gummed down onto the rib cage behind it, and then on top of that, if you've also had radiation to your chest wall, so over the top of the radiation, and the tissue around the mastectomy scar is also quite thick, hard, gummed up, stuck down, you can imagine that the cording that is coming through here and intersecting with this area where there's scar tissue, not only surgical scar tissue but also radiation scar tissue, those two things are really not helping each other out in terms of resolution. So the women that are coming in who've had a mastectomy, who have chronic cording, I'm now a lot more on the lookout for why their cording hasn't resolved, and I think it is mainly to do with the fact that if you don't treat the tight mastectomy area and you only try to address the cording, then you're not going to get very far. So previously I've done 3 videos on cording. The first video, which I'll leave a link to here, is about neural flossing, which is the first level exercise that I give all of my patients who are experiencing cording to do. This can be done at home, but I'd certainly recommend, if you can get to a physiotherapist who's experienced in treating patients with breast cancer, it's a good idea for them to walk you through these stretches when you first start to perform them. If you can't do that, at least follow the steps of that video, and that should get you started with addressing your cording. So neural flossing is what's addressed in that video, and that's just starting to put a mild stretch on the cord. As we discuss in the videos on cording that I've done previously, cording is just tight nerve tissue, and it often occurs because of the surgery that's done in the axilla or the armpit to remove lymph nodes. There's a lot of nerve tissue that runs through that region, and I suspect that just because of the job the surgeons have to do in this region, the nerve tissue gets tight and then cording forms. So ironically, it's not necessarily much to do what's happening in the breast or the chest wall, it's more so what's happening in the armpit. So the first video is about neural flossing. The second video is about neural tensioning. So that video I'll leave a link to here. That's called How to Resolve Stubborn Cording. What I didn't cover in that video though was this section that I'm talking about now, which is addressing the other areas around the cord that could be contributing to the reason the cording's remaining a chronic problem. So in that second video on how to resolve stubborn cording, I'm talking about tensioning the nerve in a more aggressive way. And if you want to go and check that video out to see how you can do a more aggressive stretch on the cord, then go and check that out. But the idea with the neural tensioning is that if you've done neural flossing for 2 to 4 weeks and you've gained some range but the cording's still hanging around a little bit, it's a really good idea then to step up to neural tensioning, which is essentially putting a stronger sustained stretch on the cord. And as I'll mention a little bit later in this video, I think one of the most important things people need to know about cording is the fact that if it has become a bit stubborn and a bit chronic, you do generally need to get a little bit aggressive with it. So by aggressive, I mean you have to put a decent stretch on that nerve to get it to let go. Similar to a chronically tight muscle. If you only ever really gently stretch a tight muscle, you may not get it to loosen up. And it's the same with nerve tissue. The third video I did on cording was how to perform massage on cording. Now I should put a little caveat in here, guys, and just say I really appreciate the comments that have been coming into the channel about requests for demonstrations of how I perform massage on breast tissue or chest walls, scars, cording. So I'm really going to try and up my game to include some demonstrations of my actual work. I've just got to get some willing patients to be able to do these videos with, but I'm sure I'll be able to get some. So I will get some video footage of me performing some more of my work, because that's obviously going to be beneficial to physiotherapists or occupational therapists who are getting into treating breast cancer patients, but also beneficial for patients who are trying to perform this massage on themselves. So I'll get onto that as well. What I am going to show you a little bit later in this video, though, is some photographs of a patient. So thank you very much to the patient who volunteered to have those photos taken of a treatment technique that I have been using on this particular lady for some stubborn cording. So we'll go into that in a little while. So one of the treatment techniques that I wanted to talk about in this video is a treatment technique called cupping. Now, some people who are watching this video may have heard of cupping before. This is an example of a cup. This is a big cup, a bigger cup I should say, but they can come in smaller sizes, so they can be a lot smaller circumference. So they're literally, these cups are plastic, but you can use glass cups. Cupping is quite an old school technique. It's been around for a long time. You quite often see athletes having it performed on them. They come out in big polka dot bruises, but I must say the cupping I am doing at the moment on my breast cancer patients doesn't necessarily involve huge big bruising, but this has been quite effective for helping stubborn cording to let go. So I'll show you some photos now of this lovely lady who I'm treating at the moment, who's had some chronic cording. Now, interestingly, this particular patient had not been started with neural stretching before she came to see me, and I think therein lies one of the first problems. If you are not getting a decent nerve stretch on the cord, you may find your cording hangs around. It's not necessarily good enough to just do muscular stretches in the area of the cord. It's just not going to put enough tension on that cord to make it let go. So you really do need to be doing neural stretching to resolve cording, in my clinical experience. The second thing is you generally need to target or attack stubborn cording from lots of different angles. You don't just do massage, you don't just do neural stretching, you should also try things like cupping, but you can also be treating the tight areas around that cord. So if you are finding that you are doing all the neural stretching in the world, even being quite aggressive with it, then get a physiotherapist or an occupational therapist who has experience with treating patients with breast cancer to look at the structures that are surrounding that cord. It may be the back of your shoulder, your pectoralis muscle, it could be a tight surgical scar like a mastectomy, or there could be scar tissue, generally speaking, in the area of the armpit. So there's lots and lots of different areas that a physio, massage therapist, occupational therapist might be able to go and have a look at to see if it's contributing to the cording not being able to let go. So lastly, I'll just show you the photos of this lovely patient that I've been looking after. She's had some stubborn cording, which is slowly starting to improve. We've started with neural stretching, as I mentioned before. She has already moved on to neural tensioning, which is that sustained aggressive stretch that we put on the cord. We're performing massage on the cording, but now we've just upped the ante again to include cupping on the cord. So I'm going to put up the first photo, which is a photograph of her cording. But as you can see, if we move on to the second photo, this is describing where we have placed the cup along the line of the cord. There will also be a cup on the end of her mastectomy scar. So we're really trying to alleviate the adhesions in that area of the mastectomy, but also the field that's been radiated. So we're really trying to supple all of that tissue on her chest wall where the end of that cord intersects with the chest wall. So if we treat all of that gummed up tissue, this is also going to help her cording get more mobile and hopefully resolve in time. I'll just put a little note here though as well to say that I have treated a lot of patients with cording, and it is absolutely worth persisting with treating it. It generally does get better if you persist. Most of the time you just have to find out what is holding that cord back, whether you need to be more aggressive or release another area, or you need to try a different style of treatment technique like cupping as an example. So as you'll see from this other photo, this is a photo of her cording after the cupping's been performed. And as you can see from the photo, there's quite a reduction in the visible tension in that cord. So it's dropped quite a bit, and following treatment, the patients will often report there's a better freedom through their arm range of motion once the cupping has been performed. So if you have stubborn cording, remember that you need to attack it from multiple angles, try multiple treatment techniques, make sure you are getting a stretch on that nerve, not just the muscular structures in the area, but a stretch on the nerve itself. And if you're really not sure how to get a stretch on that nerve, check out those earlier videos that I've done on how to resolve cording after breast cancer or how to treat stubborn cording. As I mentioned throughout this video, also check out other structures around the cord that might be gummed up, tight or restricted, like a mastectomy scar or a field of radiated tissue, which could be intersecting with the existing cord and holding the cord back from being able to let go. If you have any questions on cording or how to resolve stubborn cording, please leave a comment in the section below and I'll try to get to your questions as quick as I can. Thank you so much for watching this video, guys. I hope you've gained some great information. If you have any questions, please leave a comment in the section below. Hope you're having a great week wherever you are. I'm Jen McKenzie, the Breast Cancer Physio, and I'll see you next time.